22 years old, and I have been battling ulcerative colitis for the last 5 years, and I've undergone 10 surgeries and 6 months of chemo, and still the doctors aren't quite sure as to what's wrong, but we're battling it slowly, and every day is another step towards finding out what's actually wrong and the disease, and then once we have the disease we can actually start towards a cure.
We're the Lahosiks. I'm Vicki Lahosik.
This is Jack, and I'm Jake.
And when Jack was just over 1 year old, we had a benefit for Jack when he was just over 1. He was diagnosed at 5 months old with an eye disease called retinoschisis. The community benefit tree was wonderful with helping to organize it, because this idea of wanting to do a benefit was great, but we had no idea where to go and what to do.
They help guide everyone and give support to how it's worked in the past and how they were able to just give ideas and make it go a lot smoother.
And then all of the things that we used the actual day of the benefit, just the things that we hadn't thought of, that they had brought to our attention, and the things that we borrowed from them to use the day of the benefit was wonderful.
My name is Brenda Marcourt, and I came to know the community benefit tree when I came down with breast cancer. I guess this was something I didn't expect at age 35, so I was completely devastated. And because of the help of the community benefit tree, I was able to not worry about the financial part and just worry about getting better. And I think it really turned my attitude around, because I didn't have to worry about everything else, and I just had to look into my family's eyes and know that I had to be here for them.
My name is Rhonda Miller. My biggest worry was if my husband was going to live or not. He was diagnosed with a brain infection. The benefit helped immensely. It helped with the medical bills, it helped with food, it helped with all of our bills, our house bills, things like that. And it took a huge burden off of me. So like I said, I could help my husband and my kids, and I did not have to think about those things. I just paid my bills.
Hard to put into words, because people who I didn't know before this did so much for our family. One thing that's important to remember is that even though you are getting this help doesn't mean you're in this position forever. You are able to, recover and live a good life and a meaningful life. So.
The community benefit tree, they were very compassionate, they were very supportive, and very easy to work with. always there to answer questions. I think we called them so many times, and I felt like I was bothering them by calling so much, because and the other members of our benefit, you know, when they called, they were always willing to answer questions and help us through every step of it.
I'd like to say a big thank you to Carla and Heidi and everyone else at the Community Benefit Tree. There's a whole family there of people there that are working behind the scenes and doing everything to get these benefits up. And I guess the main thing I want to get across is that a lot of times people don't go out and help others with chronic illnesses until they have personally been affected by it. And that's one thing, there's millions of Americans struggling with, you know, chronic illnesses and chronic diseases. And so it's just kind of the pay it forward aspect, that help give to anyone when you're financially or socially stable. Help give to someone, because you never know when you're going to need the help. And that's what Community Benefit Tree is here for, is to give the help when, you know, everything's taken away from you.